Service and Administration Minister Senzo Mchunu is visiting the Sir Henry Elliot Hospital in Mthatha. The hospital will be one of the sites administering COVID-19 vaccines in the region. The minister will inspect the hospital's rollout plan and state of readiness. This visit follows a decision by the Inter-Ministerial Committee to promote transparency in government's handling and storage of vaccines. Let's bring in SABC News reporter Atule Joka. He's live for us at the St. Henry Elliot Hospital in Mthatha. Atule, a very good morning to you. So I'm just looking at some of the numbers as of the 18th of March, that was yesterday, with regards to this vaccination rollout. And the number of healthcare workers under the Sisonke protocol stands at 177,275. What's the situation where you are?
Okay, well, thank you so much, Blaine. According to the last report that was published by the Department of Health in the Eastern Cape, over 3,000 workers had been inoculated here in the Eastern Cape. But as you see behind me, there are scores of healthcare workers, your doctors and the nurses and other health practitioners. They are here to take their jabs. So a lot of people, most people, did come out of their numbers. We did chat to them earlier on. They are very excited. They are looking forward to taking those jabs, Blaine. So the Minister of Public Service and Administration, Mr. Senzo Mchunu, will be here in no time. He is expected to be here in an hour to conduct those walkabout visits to check the competency of this hospital, the storages, and also the readiness, and also some of the people who've taken their jabs and on their readiness, on how ready they are, Blaine. Yeah,
tell us about, so you're saying that the healthcare workers are gearing up to take these vaccines, and they for it, from what you've learned. What about the public as well, Atule? Give us a sense of what they're feeling, any apprehension with regards to these vaccines when it is eventually rolled out to the general public. What's the temperature of views on the ground?
Okay, as you would understand, Blaine, these are the peripheral areas, these are the rural parts of the Eastern Cape. So most people there, when we went to them about a month ago, they did say that they need more of information, to be told more about this vaccine, about its efficacy, and also some of the after effects that might be there. So they needed more information before they are able to take those jabs. But as we were talking to people as well, they were asking, why is this a slow rollout of this vaccine as well? Because they are the elderly people who are mostly here in the Eastern Cape, so they are quite concerned about that, and also those people who are on chronic medication. So there's the critics have been saying that there's been quite a slow rolling out of this vaccine. So when that third wave hits, the elderly here in the Eastern Cape, and mostly people with chronic diseases, and some maybe of the healthcare workers might be affected. So that's the situation on the ground. That's how people are feeling. But I'll speak to my colleague, video journalist Mgubasi, to just show you a sense of the people here, Blaine, to just see people who have come out in numbers, just for me to step out on the shot, for you to show them. These are all healthcare workers here in the Eastern Cape. They are ready with their documentation, signing their forms. They are ready to take those jabs, so that when this roll out, especially when it goes out to the people in the rural areas, and also when it goes out to people in the villages, they have already taken, they are already protected, they have already prevented this variant of COVID-19.
Just looking at the numbers with regards to COVID-19 in the Eastern Cape as of yesterday, according to the statement released by the Health Department, Eastern Cape, a total number of fatalities, and these numbers can never be abstract because these are lives lost. 11,000, over 11,000 people have lost their lives in your province, Atule. But just looking at the active cases, according to this statement that I'm looking at, it's only at 285 active cases, 285. What are officials, medical experts, attributing this success to?
Okay, most healthcare workers are saying because people here in the Eastern Cape do not have, maybe it's still backwards. So most people do not have their own spaces where they are able to practice adequately those social distances. Most people are not on medical aids and so forth. So they are saying every time that the country is moving down and moving down to alert level 1, they are experiencing such a surge in high numbers of people, and also those death rates are also piling up. So they were saying the government must not implement this blanket approach, but for sure the Eastern Cape must be treated with the sensitivity that it deserves. It must be treated accordingly with the situation that is here in the Eastern Cape, because every time we are moving down the levels, most people here do go out and get infected, Blaine.
Yeah, look, the Eastern Cape, when we look at the numbers across other provinces, it's relatively low. It's the lowest at 285 active cases. So Atule Joka, we thank you very much indeed for your reporting. We'll check back with you a little later on. We were going to take you to